Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them swimmingly. Today's quiz-style video reviews key points from our first bacterial infection series with case-based questions to test your recall and clinical reasoning. Let's get started. A 26-year-old woman who moved from Nepal 3 years ago presents with a month of shortness of breath while walking. She also reports new swelling in both feet, which prompted her clinic visit. She recalls frequent sore throats during her teenage years, often treated with antibiotics. On exam, you find signs of heart failure and suspect valvular heart disease. Which heart valve is most likely affected? Next, a 3-day-old boy in the NICU was doing well after birth, with a strong initial cry and stable vitals. Now, he develops a fever and becomes less responsive. On exam, the soft spot on the baby's head feels bulging. The mother had only one prenatal visit early in pregnancy and delivered unexpectedly before reaching the hospital. Blood and cerebrospinal fluid cultures from the baby are sent. Which of the following best helps identify the most likely causative organism? Next, a 64-year-old man is brought to the emergency department for fever, cough, and shortness of breath. He has a history of hypertension, with past readings as high as 180/110 mmHg. On arrival, his blood pressure is 90/50 mmHg, and his heart rate is elevated. You send blood cultures and immediately start ceftriaxone. The result of the gram stain from the sputum is shown. Which of the following isn't typical of the suspected organism? A. Doesn't grow in 6.5% NaCl. B. Doesn't belong to any Lancefield group. C. Doesn't exhibit bile solubility. D. Doesn't show beta hemolysis. Next, a previously healthy 3-year-old boy is brought to your clinic with a red, crusted lesion between his nose and upper lip. During the exam, you notice redness and swelling around the mother's right index fingernail while she's holding the child. When asked, the mother reports that her second-grade daughter was recently treated for a boil on her shoulder. You prescribe oral antibiotics and advise antiseptic baths and frequent washing of towels and clothes. You also recommend applying antibiotic ointment to which of the following areas? Next, a 72-year-old woman is admitted for a stroke and initially remains stable. She breathes comfortably on room air, awakens spontaneously, and answers simple questions appropriately. A few days later, she develops a fever and tenderness at her IV site. Cultures are taken, and vancomycin is started empirically. Despite IV relocation, the original site worsens. Blood tests show gram-positive cocci in short chains. Which of the following statements is true about this organism? A. Doesn't cause hemolysis. B. Doesn't have a Lancefield group. C. Doesn't grow in 6.5% NaCl. D. Doesn't live in the gut. Next, a 21-year-old newlywed woman with no prior medical issues comes to your clinic complaining of painful urination and mild lower abdominal discomfort. She denies vaginal discharge or fever. Suspecting a urinary tract infection, you instruct her on how to provide a clean catch urine sample and begin empiric treatment with cotrimoxazole. As the results are pending, you review possible organisms in your head. Which of the following is the most likely finding on urine culture? A. Gram-positive bacilli. B. Urease-positive cocci. C. Coagulase-positive bacilli. D. Catalase-negative cocci. Next, a 13-year-old girl is brought to urgent care for puffiness around her eyes that started 3 days ago. She also reports blurry vision, a dull headache, and fewer trips to the bathroom over the past day. On exam, she appears tired, and her blood pressure is 160/110 mmHg. Her mother recalls a sore throat 2 weeks ago, treated with antibiotics. Which type of gram-positive cocci is most likely responsible? Next, A 30-year-old man with a recently implanted prosthetic valve for severe mitral stenosis presents to the emergency department with fever, difficulty breathing, chest pain, and blood pressure of 85/60 mmHg. Blood cultures grow gram-positive cocci in clusters. Which of the following characteristics best describes the likely pathogen? A. Produces coagulase. B. Produces biofilm. C. Produces M protein. D. Produces greenish zones on blood agar. That's it for our first bacterial infection quiz. If you'd like to check your answers, just head to the link in the description below. If some of the questions felt tricky, feel free to revisit our bacterial infection video series to reinforce the concepts. Found this helpful? Give us a like, share, and subscribe. Check out our next video. Thanks for watching.